Amlodipine clinical uses. Amlodipine is a calcium channel blocker used to treat hypertension, high blood pressure and chronic stable angina. It may also be used for vasospastic angina, Prinzmetal's angina. Dose: hypertension 5 mg once daily, may increase to 10 mg if needed. Angina 5-10 mg once daily, maximum daily dose 10 mg. Side effects of amlodipine. Common: peripheral edema, dizziness, flushing, headache, fatigue. Rare: palpitations, nausea, abdominal pain, gingival hyperplasia. Contraindications of amlodipine. Hypersensitivity to amlodipine or other dihydropyridines, severe hypotension, cardiogenic shock. Treatment plan: start with 5 mg once daily, monitor BP, and adjust as needed. Avoid abrupt discontinuation.